so we can get started. Again, I'm Nikki from the Massachusetts Health Connector, and I'm joined today by my colleague Melissa from Health Connector for Business. Together, we will be presenting today's information and answering your questions. Before we get started into the presentation for Health Connector for Business, we'd like to take a moment to thank our partner organizations, including our broker community, for promoting today's session, and thank you for taking time out of your day to join the session. So before we get into the content, we just wanted to go through some of our housekeeping information so that you have more information about our presentation format. So just know that everyone's audio has been muted, video has been turned off. In terms of the actual presentation, Melissa will start us off, and she'll be doing the predominantly most of the presentation today, and it will last about 30 minutes. After Melissa and I both present, we'll have time for a question and answer period. And if you want to ask a question at any time, you can use the Q&A button at the bottom of your screen. We'll be looking at your questions throughout today's presentation, but know that we will answer questions at the end. As a reminder, we ask that you do not share any personal information or private health information when you ask your question, as others on the call may be able to see what you write. And we are recording today's session. So following today's session, you'll receive an email with this presentation and the link to the video recording. So there's no need to take detailed notes. Now, before we get started, I just want to confirm that we are ready to go, Melissa.
Yep, ready to go.
Okay, great. So I'm going to hand it over to you. Thank you so much.
Thank you. So yes, I am Melissa Stearns, and again, the title of today's webinar is Health Connector for Business, Affordable, Flexible Health Coverage. So just as an overview of today's webinar, we will touch on who and what is the Health Connector. Again, we are going to be focused mostly on Health Connector for Business today. So we will discuss how to get started as a business, savings, through our comparison shopping, our flexible choice models, rebates available through our ConnectWell program. We will touch on the small business healthcare tax credit. And at the very end, we will also go over some options for sole proprietors and owner-only groups on the Health Connector. So what is the Health Connector? The Massachusetts Health Connector, you can think of us as the marketplace for the state. So we offer coverage for individuals, families, and small employer groups across the state. Businesses can offer small group coverage to their employees through the Health Connector for Business. Anyone who doesn't get health insurance through their job or other sources may apply for individual coverage. Many people who apply do qualify for help paying for their coverage, now with even more savings due to the American Rescue Plan. And you are able to purchase dental insurance through the Health Connector as well. So anyone enrolling through the Health Connector can rest assured that all of the plans sold through our platform meet the state and federal standards for coverage. So we do offer qualified health and dental plans, which allow you to choose from a variety of carriers depending on, your needs and your area. Catastrophic plans are available to those under 30 or with a hardship exemption. Health plans with advanced premium tax credits available for people with incomes in a certain range may qualify for more credits to reduce their cost of monthly premiums. Again, dental plans are available for individuals, children, families, and small employers. This includes pediatric-only plans and plans with lower and higher deductibles. We have connector care plans for people in lower income ranges who meet other eligibility requirements. You may qualify for low or no cost health insurance coverage. And of course, the Health Connector for Business available for any small group employer with less than 50 full-time eligible employees. So on this slide, you're going to see a list of the carriers that are available at the Health Connector. You'll see a lot of the leading insurers here in Massachusetts: Blue Cross, Mass General Brigham, WellSense. They are all here for you. Okay, so we're going to get started on the Health Connector for Business overview. So the first thing that we want to touch on is eligibility requirements for small groups to go through the Health Connectors platform. So to be considered a small employer, you would need to have at least one full-time eligible employee, but not more than 50 full-time eligible employees at initial enrollment. So when you're enrolling, at least one non-owner, so that would be a non-family member, has to be enrolled as an employee. And the business must be located in Massachusetts. So again, the business has to have a physical address here in Massachusetts. You have to have one non-owner enrolled and no more than 50 full-time eligible employees. You'll see here under the additional requirements that in order for a group's coverage to become active, they must have at least 75% of employees waiving or enrolling. This is referred to as participation by the time the deadline, which is the 23rd to pay, comes up. So again, even if you have employees that are not electing coverage, them just going in and waiving coverage counts towards a group's participation. So if you've got, 3 employees, 75% of those need to actually do something, either enroll or waive. So on this slide, you're going to see a number of the benefits of enrolling through the Health Connector for a business. The goal really of the Health Connector for business is to maximize access and affordability for small employers. And we do this in a number of different ways. So full carrier participation. We are the only place where a small group can access all of the leading carriers in one spot. You have access to the most competitive premiums, and you'll see here small businesses save on average 20% before any rebates are applied. Those rebates with our wellness program allow employers to save an additional 15% towards what they've contributed towards our employees' premiums for the course of the year. And we'll get into that a little more on how that works. So all of the Health Connector plans are compliant again with state and federal law. They've received the Health Seal of Approval for Quality of Value, and here below are some of the range of benefits that are included to meet that standard coverage. We have office visits, emergency services, hospitalization, rehab services. There's additional information can be found on our website, but this is just a glimpse of the coverage that is offered. Some additional highlights, health savings account plans. So we have a number of plans that are HSA eligible. So of course, this is a tax advantage medical savings account, and each carrier on our platform offers an HSA compatible plan. Out-of-state coverage is available. So on the Health Connector for Business platform, if an employer has employees that reside outside of Massachusetts, they can still give them options for care. They would just need to enroll in a PPO plan, but those are available on the platform. And new to 2025, PVP flags are new addition, and this will allow you to easily identify lower than market average premiums when searching for and comparing plans. So again, that is new for the upcoming plan year. Okay, so how to get started. So if you are a new group or if you're a broker that has a new group interested in enrolling, we do have open enrollment every month for new business. So of course you would visit our website for more information and to create an employer account. It's all done online. Our deadlines are the same every month. So by the 10th of every month, you want a group to have selected a benefit package, or at least know what it is that they want to offer their employees. The employees will then have until the 20th every month to either enroll or waive their coverage. The groups will have until the 23rd to make their payment for their initial coverage. And then coverage, of course, always begins on the first of the month on the business platform. So these deadlines, again, are the same each month for new business. We strongly encourage our employer groups to utilize a broker when shopping for coverage on our platform. There's nothing but pros to using a broker. Again, we have over 500 certified on the platform. There's no cost for an employer to utilize a broker. So, the employer can reach out to a broker who will help them with plan options and enroll in coverage, again, at no cost to them. Brokers are very familiar with the plans on our platform and how the choice models work, so they can help you compare those available plans and understand which one is going to be best for your group. They're able to provide you quotes and cost estimates. So, they can do that with before you even create an employer account. And again, this really boils down to time saving for the employer. So they're able to help you not only at initial enrollment, but throughout the year if you need assistance with, changes to your employee roster, qualifying life events. A broker is just an incredible resource for you to have. The employee choice models are very unique to the Health Connector for Business platform, and we're going to kind of go over how those work. But the goal here is to allow an employer to control cost on their end while still giving their employees different options to choose from based on their needs. For the employee, what this looks like is, different plans that they can choose from that are easy for them to compare with each other, and it gives them the opportunity to pick based on their needs. So the choice models, we have three different models that an employer can utilize. The first, the one plan group, most groups are already going to be familiar with how this works. In this scenario, an employer selects just one plan from one carrier, and it's a very sort of take it or leave it approach. All of your employees, they would only be able to enroll into that one plan. The one plan model utilizes a composite billing method. So once enrollment closes, um, you would get rates finalized based on whoever is actually enrolled. It'll calculate an average. So you'll have set rates for each tier throughout the year. So anyone enrolling as employee only, anyone enrolling as employee plus spouse, they'll have those set rates locked in for the year. If you have any groups that are interested in bronze plans, they are only available through this model, through the one plan option. So again, this is nothing new. Most groups are already going to be familiar with how this works and like how this works. So that is available to you as an employer. The one carrier model is more unique to our platform. So the way this works, as an employer, you would select from one of the available carriers in our platform. Let's say, for example, Blue Cross Blue Shield. From the Blue Cross plans available on our platform, the group would select one that they are going to contribute towards. So they can find one that they, feel that they can afford. The employee, they can select that plan for themselves, or they can select any of the other Blue Cross plans available to them. Now, if the employee chooses a Blue Cross plan that is, more expensive than the one that the employer chose to contribute towards, they would pay the difference out of pocket, but they can shop up or down based on their needs. This model utilizes a list billing method, so each employee will have a different rate based on their age. And again, PPO options, so those are the plans that will provide nationwide coverage, are available at the one carrier model. You would just need to make sure that you select a carrier that offers a PPO. So this is great if you have a group that say they all use pretty much the same network, but have different needs. Someone might want a platinum plan, someone wants, isn't bothered by a higher deductible and can go down into a lower tier. This would be a great option for them. The one level works essentially the same way. The only difference is instead of selecting between one carrier, an employer would choose between a silver or gold tier. So they're selecting the tier, and from within that tier, they're going to select, again, a benchmark reference plan that they are comfortable contributing towards. So for example, say they're still going to go Blue Cross. They're going to go silver. They would select one silver plan, and that could be a Blue Cross plan. But the employee would be able to choose any silver level plan available to them. So they can go Tufts, they can go WellSense, Mass General, whatever works for them. This model also utilizes the list billing method. So each employee will have a different rate based on their own age. PPO options are available here at the silver tier. So this is a great option if you have an employee group that has, say, different network needs. You've got one that's got a doctor with Tufts, one's doctor is with Blue Cross. This would allow them to shop across multiple carriers. So a really great option. Okay, the ConnectWell program. The ConnectWell, all businesses that go through the Health Connector are automatically enrolled if they have 25 or fewer employees. So to participate, again, employees can choose from more than 30 qualifying wellness activities, and they've got the entire plan year to participate in this program. So if the employees do participate, it's just a third, right? Need to participate over the course of the plan year, a third of the enrolled employees. Then the employers can receive a 15% rebate on the contributions that they've made towards premiums for the entire year. Okay, so you'll see here the average ConnectWell rebate in 2023 was almost $5,000 for small groups. And the employees that participate will earn a $100 Visa gift card as well. And there's so many different activities that count, right, towards this approved activity, and they only have to do one. So you'll see the three categories here: mind, body, money. Things like your annual health checkup count here. Volunteer work, yoga sessions. There's a very comprehensive list of qualifying activities. So we always encourage all of our groups to participate in this program. It's very little that they need to do, and again, it makes them eligible to save quite a bit of money at the end of the plan year. This is kind of an overview of the ConnectWell process and timeline. Again, any group that enrolls through the connector, they're automatically enrolled as long as they're have 25 or fewer enrolled employees. You're automatically emailed 10 days after the start of the plan year, letting you know the steps for ConnectWell. Employees are sent emails about incentives and how to participate. As they complete the activities, they would submit the proof of that, which is all done online. It's a very simple, easy submission form on our website. Once the activity has been approved, the employees who are eligible would receive that $100 gift card. And then the groups are going to be noticed about their participation rate. So once a group has hit that 33% participation status, then they will be notified that they are rebate eligible. And then, of course, at the end of the plan year is when they would receive the rebate. And again, that's worth 15% of the annual premium contributions. Okay, the small business healthcare tax credit. This is a federal benefit, but we really like for our groups to be aware that they may be eligible for this because, again, this is another opportunity for them to save quite a bit of money. So a small business may be eligible for up to a 50% tax credit if they purchase coverage through the Health Connector. So to be eligible, that is one of the requirements, is that you enroll through the Health Connector for Business. We are the state's platform, so all groups automatically meet that eligibility requirement. And then we always encourage them to check into whether or not they meet the other requirements. So you'll see those listed here in greater detail. And of course, you can always, again, this being a federal benefit, check the irs.gov website. We have the link here on the bottom of the page for up-to-date criteria as far as the other requirements. But this is something we strongly encourage all of our groups to find out whether or not they are eligible for this tax credit. So employer experience with the Health Connector for Business. We like to go ahead and let you know what this is like for a lot of our groups. Obviously, savings is huge for any small business. And as we kind of mentioned earlier, small groups save over 20% on average just by shopping through the Health Connector for Business before any rebates like our ConnectWell rebates are applied. So here you're going to see kind of an average of what those savings look like by tier. So that's kind of what this graph is displaying. So you'll see platinum, gold, silver, and bronze tiers. And this is, looking at premiums that they're paying on the exchange and off the exchange. So you'll see it's quite a savings, nearly 9 million per year on health insurance premiums on average. So something that we're definitely always trying to find ways to be competitive here. On the employer side, the experience with the Health Connector for Business, again, group shopping through the Health Connector receive greater cost savings due to things like our employee choice models. So again, offering employees that flexibility, but still controlling costs for the employer. The ConnectWell program and those rebates, the tax credits, and there are no fees. So no fees or membership dues for enrolling on the Health Connector for Business platform. For now, I'm going to let Nikki talk a little bit about their options for anyone who's a sole proprietor or owner only on the individual platform.
Thanks so much, Melissa. And again, everyone, thank you for joining us today. So I think one of the things that's really important to note is that if someone is a sole proprietor or owner only, they're not able to enroll into coverage through Health Connector for Business. But there still are options for coverage through the individual side of the Health Connector, and that is available at mahealthconnector.org. So good to know is that right now we're in the middle of our open enrollment period. So November 1 through January 23rd essentially is the time of year when anyone who's an individual or a family, or in your case, a sole proprietor or owner only, they can come in to apply for coverage, shop for coverage with coverage that's going to start on January 1. Now, all of our Health Connector plans, Health Connector for Business and for those for individuals and families, start on the first day of the month after someone enrolls. And if you are a sole proprietor or owner only and you are in need of coverage sooner, simply just apply. I think what's really important to note in Massachusetts is that we have an integrated eligibility system with our colleagues from Mass Health. And sometimes, particularly if somebody is just starting their business, they may find out that they're actually eligible for Medicaid or Mass Health coverage. And that has different enrollment start dates. They're actually a little bit more generous and can start mid-month. So certainly the takeaway from this slide is apply, apply, apply if you need health insurance coverage. So going on to the next slide, just how somebody goes about this and who can actually apply. So we have some requirements. Individuals do need to live in Massachusetts. They need to be lawfully present. So essentially that means they need to be a U.S. citizen, U.S. national, or have that lawfully present designation. And also, since we are the Massachusetts marketplace, we're really here for people that don't have access to other health insurance. So if someone is already eligible and enrolled in Medicare or the state's Mass Health program or other public health coverage, let's say certain veterans benefits, those folks should not apply because there is an offer of affordable coverage. Now, also there are a couple of, you can see down below, again, through the marketplace, we're not able to offer savings to anybody who is offered an affordable comprehensive plan from an employer or if somebody is incarcerated. Now, what do you need to apply, and is this something you can do on your own? I like to tell folks, and Melissa, I'm not sure what you would say on the Health Connector for Business side, because it's a little bit different if you're, shopping for multiple people. But if it is just you and you are, just applying for yourself, or maybe you and your partner, or you and a child, it's a fairly simple process. Just need to. It's almost like doing your online taxes. I like to say, get your drink of choice, whether it's coffee, tea, whatever. Sit down in front of the computer, get your, important documents together, social security numbers for people that you're applying for, immigration documents. If you are applying for individual and family coverage and you're trying to find out if you can get some assistance, you want to be able to provide us with copies of at least your last 2 pay stubs. If you happen to be unemployed as you're, starting this entrepreneurial process, we need to know about those dollars. Or if you, let's say, have net income from self-employment, that's the kind of information the system and the application is going to need to assess if you could, in fact, be eligible for savings through the Health Connector's individual and family platform. So you will get this deck. You will get all of these important links. And I think the takeaway for this slide is, if you don't have all of the information as you're going through the application, you can still get to the end and it will give you a result, but it will also ask you for basically asking you to send in any information that we need to make a final confirmation about your eligibility. Okay, so I keep talking about health paying for coverage through the Health Connector. And again, this is specifically for individuals, families, or in your for folks who signed up for today's presentation, if you're a sole proprietor or owner only. I want you to know that there's something called advanced premium tax credits, and unique to Massachusetts, we have something called the Connector Kit program. So Melissa touched upon these two concepts a little bit at the beginning, but I just want to dive in a little deeper and just say, with advanced premium tax credits, this is something that we're able to offer individuals because we are the state's marketplace. So these are federal dollars that lower the premium amount somebody has to pay each month. And the way it works is that the IRS sends those dollars directly to the health insurance carrier, depending upon the plan that you choose. And you, as the consumer, simply pay the lower amount. So you don't have to worry about, getting those funds and then doing something with it. No, no, no. You just get a lower monthly bill. Now, again, unique to the Massachusetts marketplace is what we call the Connector Care program. And we're able to offer comprehensive plans with lower premiums and great benefits because we take the advanced premium tax credits that a person is eligible for, plus add in additional state funds. And that's how the reduced premium amount gets calculated. Now, if you are just starting out in your business and a lot of people sometimes aren't taking any income when they're starting, right? We all know this. These are great things to check out, and we'll give you a link so that you can see, you can do a little estimate to see if maybe you might be in the situation. But know that these are lower monthly premiums, low out-of-pocket costs, no deductibles. And you could see savings or plans for as low as $0 or even $264 a month. Again, depending on what you choose to enroll in and your personal situation. So we are giving you a ton of information today, and you might be wondering, okay, who can help me with this? Maybe you feel confident. You're like, just give me the website. I'll do it on my own. Or perhaps you want to have a conversation with someone before you get into this a little bit more deeper. As Melissa said, there are I think you said over 500 certified brokers right now who can help on the Health Connector for Business side. We also have a lot of support on the individual and family side. So we do have a dedicated customer service who can help. And we also have dedicated community partners who have been trained and certified by the state. And these folks can help anyone from application through enrollment. And as Melissa said, they're here every step of the way. So it's just like a broker. If you are partway through the year and let's say your income changes, all of a sudden your small business is like going through the roof. This is great. Or maybe, you aren't earning as much as you thought you were going to earn, and you want to report that change to see if you can get a little bit more of a break on your health coverage. These folks are here to help you. So you'll get the stack, you'll get the links to find free help near you. And again, these folks are not brokers, but they are certified assisters. Now I'm going to hand this back to Melissa because we did go over like certain ways that Health Connector for Business and individual and family are similar, but there's still differences in timelines and deadlines for Health Connector for Business. So I am going to pass this back.
Thanks so much. So again, like Nikki said, any small business employees and owners that don't qualify to offer coverage through Health Connector for Business can still get coverage. Just visit our website, mahealthconnector.org. Now, the small business employees and owners that do qualify to offer coverage on the business platform, again, the deadlines are the same on the business platform every month. So on the 10th, just think of that as that first deadline to have selected the benefit package that you want to offer your employees. That gives them another 10 days to make their decisions for which plan they want or if they're going to waive coverage. So the shopping deadline will always be the 20th of every month. And then the 23rd is always going to be the deadline for the employer to make their first initial binder payment for that first month of coverage in the billing portal. Now, of course, if there's a holiday or something that falls on the 23rd, we make those adjustments and you will be notified. But other than that, these deadlines are going to be the same every month for small group. Okay, questions, and happy to take a look at some of these questions.
Yeah, so we've got lots of great questions, Melissa. I don't know if you just want to, it's up to you. We can simply just go down the line.
Yeah, let's do that. Okay, so it looks like here, how does the connector offer discounted plan rates from other marketplaces when the rates are regulated by the DOI? Well, again, the plan rates, there's discounts as far as like our rebates. Again, I'm not sure, I guess, like you mean in addition to the the rates? I'm just hoping I answer that or I'm understanding the question correctly.
Yes, and I think if this person wants to just provide a little bit more information, I think it might just be important to note for everyone that the Health Connector goes through an annual, what's called a seal of approval process. So essentially, all of the rates are, in fact, regulated by the Division of Insurance. Um, and whether it's on the individual side or the Health Connector for business side. And I think we see, because of the competition, and also the choice that small businesses make. I think that's one of the reasons why I don't know necessarily that they're discounted, but I think some small businesses are making different decisions, Melissa. Would you agree? But
Yes.
of course, I don't want to take away the wellness component, but I'll
Right.
let you.
Yeah, and the wellness, of course, program does offer the biggest savings to our groups, and overall, just the way that we're able to offer coverage through the choice models. It gives the employer just that kind of option to know exactly what they're paying and have a set amount for themselves based on the employees actually enrolling with their groups, and while giving the employees those different sort of options too. But yeah, that's a very, very good question.
And Melissa, can I just add that for the wellness program, those are actually state dollars that the employer is getting that can help offset the cost. And then the other tax credit is a federal tax credit. So maybe that will help this person as they think about, discounts and offers.
Definitely. Is there a full list of qualifying wellness events to give the employees for ConnectWell? Yes, there is. And the link is in the presentation. You can also, if you go to mahealthconnector.org business, you can find the submissions page and a full list of qualifying ConnectWell activities. There are a lot of them and they are available there. And of course, if you have any questions or you're not sure if something counts, you can always reach out to us. We have a ConnectWell representative and we can assist you and by confirming that. What if we are owners of an S Corp, but also W-2 employees of the company? Do we qualify for the small business group plans? So you can be an owner and enroll and qualify for the plans. You just have to have at least one non-owner enrolled as well to qualify. So you can be an owner, a W-2 and a W-2 employee and enroll, but you have to have at least one that is not considered an owner enrolled, if that makes sense. And of course, if you have any questions about that as well, you can always give us your specific sort of situation and we can verify that with our eligibility specialist.
I think
Hello.
the next one is for you as well, but I'm happy to help if as we
Sure.
go. Okay.
Hello, for a family business partnership type, there are two owners, let's say A and B, and both A and B spouse working. Is the group eligible? So a spouse, so two owners and both the spouses would essentially be considered owners as well. So based on that alone, like if it were just the two owners and the two owners' spouses, that would not be eligible on the small group side. You would need to have at least one non-owner still enroll. So the spouses unfortunately would count here as
And Melissa,
owners.
and Melissa, I want to answer this from an individual and family side too. So let's say you were, um, so let's take Health Connector for Business out of the scenario for a moment. If you had two people who were business owners and then their spouses had an offer of employer-sponsored insurance, um, those separate partners, if you will, when if they applied on the individual and family side, they individually would need to um, mention or indicate that they do have an offer of ESI. Okay. So sorry, didn't mean to confuse the situation, but just in case
No.
there are people out there saying, well, wait, we're in a different kind of situation. Like, do I have to get coverage through my spouse's ESI? And the answer is if you are seeking coverage and you want to go to see if you can get savings, the rule would be that you would need to go to the spouse's ESI.
Awesome. Thank you. It's helpful. Do you recommend using a broker for individual and family plan as well as business plans? So currently we don't utilize brokers on the individual platform. We have the navigators that Nikki kind of touched on who are very knowledgeable about all the plans, and they are extremely helpful and can help anyone looking for individual and family coverage. But we currently utilize brokers only on the small business platform. How to access a broker, you can, if you are a group that has created an account in our system, you can do it right there. You can browse brokers directly from your employer account. When you select one, they are notified that they have been selected as a broker. We often reach out to them as well. So that's one way. You can also search, we have an external broker directory on mahealthconnector.org. If you just go again to the business section, you will be able to browse the directory there, and you can reach out to the brokers on our platform. What kind of administration is required from the business owner once the plan is up and running? So if you mean sort of like throughout the year, kind of like maintenance, what you have to do, very little. You are notified. Obviously, you're going to want to maintain your group's roster. So if you have changes to employment, right, you have an employee that's enrolled that has been terminated, or you have new hires, you want to do things like that routinely, right? Keep those things up to date in the account. As far as premiums, the Health Connector will bill you every month for all of everyone enrolled, but you only pay the connector, which you can set up auto pay for that, so that can kind of make that even easier for you. And then on your end, you would deduct any through your own payroll, the employee share, depending on how much you have split those contributions. But yeah, very little on the owner side has to be kind of done. Just, you just want to make sure that your information is up to date and your employees' rosters are correct. We highly recommend that. Yep, our email, I will definitely post my email address here for you guys, so that you can, if you're interested in becoming a broker, that's great. And I actually would be giving you that training as well. So be happy to do that. Is there a different training about renewals? Yes, John, we do have renewal specific webinars. I'm not sure exactly when the next one is, but also shoot me an email and I have a renewal training PDF that I can send you that basically is the presentation in PDF form. So, and I can also answer your questions too. How many hours are considered full-time in Massachusetts for an employee eligible for insurance? I believe that is 30 hours. But right, yeah, I believe it's 30 hours. I am the sole owner and I employ my wife. Can we go through the business section for insurance coverage is if there are only two of us and we would be seeking a family plan? Okay, so in this situation, you would want to shop on the individual and family side because you would need at least one other person besides your spouse enrolled because your spouse in this situation would be considered an owner as well. And then, of course, if you can enroll on the individual side and later on, if you have an employee join that needs to enroll, again, we have enrollment every month for new groups, so you could just kind of make that switch then. Does it make sense to enroll in the Health Connector for Business if I only have two full-time employees? Will it save them money if they already get their coverage through the connector as individuals? I definitely strongly encourage you to find out. Have some quotes ran. We certainly have unique options for enrolling into coverage for those employees, even if it's only two. The majority of our groups on our platform are smaller size groups. We have plenty of groups that are in that size range, 2, 5, 7 employees, and they love the options available to them. So I would encourage you to have some quotes ran and look, definitely. In the small business program, what if the employee is also a child under 24? Can that employee be considered an eligible employee for the business? So if the employee is a W-2, like actually an employee, yes, they're eligible, but you just have to have at least one other person that is not an immediate family member enrolled as well. So with family members, spouses, children, they are going to be eligible as long as you have one person enrolled that is not in that same category.
And Melissa, that person added additional context, but I think here, I'll let
Ah.
you read it. I think but I think what you've said still applies.
It would still apply, yeah, but I do encourage still outreach me for if you have kind of a very unique billing situation, just always good to just double check with our policy and verification specialists, because there's sometimes new things that come my way. So always worth asking. Anyways. Okay, those were very good questions.
Fantastic. So it looks like we have a couple of more minutes. So if anyone has any questions, please. Okay, great.
Can the business pay the premium for employee if there are only two employees and both are family members? Um, so again, if the only enrolled employees are immediate family members, you would go on the individual side until you had a full-time eligible employee that was not an immediate family member enrolled. So uh, and the small business owner, of course, with any groups that are applied, the contribution, yes, they set the contributions when they set up the benefit package, and the minimum for an employee is 50% towards the plan that they select. To contribute towards, it's a minimum of 50% towards employees, and if they're going to offer coverage to dependents, the minimum is 33%. But again, you got to make sure you've got that one non-family member, non-owner enrolled. Good question. My email will be included in the follow-up email that you get with the presentation. Again, I'm Melissa, so you can email me directly.
Great. And again, for those of you that joined late, as Melissa just said, you'll get the complete presentation. You'll get a copy of the recording. And yep, Melissa will definitely add your email address in there for any of the small businesses that have follow-up, like unique questions.
Well, thank you again for coming, and hope you have an awesome rest of your Wednesday.
Right. Thank you, everyone.